Healthcare, should our government go universal and nationalize the healthcare sector? About 15% of the economy. Joining us now, Noam Shivers. He's senior editor at the New Republic, and Grace Marie Turner, president of the Galen Institute. You know, Grace Marie, I was trying to ask this of Bertha Combs earlier before I lost her, but my math isn't all that good. You got to explain this to me. If the federal government adds 50 million uninsured to the ranks of insured, how is that going to come out cheaper? I don't get that.
Exactly right. If they create a new public plan, a new government insurance plan that looks like Medicare, which is already, as you pointed out earlier, deeply in debt. We're going to find out more this week exactly how much in debt. How is that going to help reduce healthcare costs? It's all a house of cards.
So, Noam Shiver, let me ask you, I mean, we know we're about $80 trillion plus in the hole in a bankrupt Medicare system, and Team Obama wants to add 50 million people to the ranks of uninsured and basically run it through a new company that's going to be government-backed and looks a lot like Medicare. How do you do this without bankrupting everything we do?
Well, Larry, I'd say a couple of things. One, we know that Medicare has far lower administrative costs, far lower overhead costs than the private sector. So for one thing, Medicare is just a far more efficient organization than most private insurance companies. Second thing is this idea that we don't pay for the 50 million people who are uninsured is just a lunatic idea. We pay for them. They show up at emergency rooms, and your healthcare premiums end up being much higher as a result. So far better to treat people proactively, to take the appropriate preventive care to prevent them from developing chronic diseases, which are far more expensive to treat rather than preventive care in the first place. In the long term, that is going to ultimately lower healthcare costs, lower healthcare as a share of GDP. I don't know why you wouldn't want to do that.
Tell that to the CBO. The Congressional Budget Office has said over and over, we do not see any savings. Preventive care is great. We don't see savings from it. Coordinated care, that's great. We don't see savings. Use of health information technologies, that's only going to cost us money. These are all good things to do. To pretend this is going to save money is really ridiculous. And also that the federal government is going to run something more efficiently than the private sector, it doesn't pass the last test.
But the federal government already does run health insurance far more efficiently than the private sector.
Not when you count all the costs of Medicare. Absolutely not.
Medicare benefits from not having to do fat cat executives enormously large salaries.
I hate those fat cat executives. They're terrible people.
But look, I think we've got a fallacy here.
One issue here, that Medicare is cheaper than private. According to Merrill Matthews in Investor's Business Daily, he wrote a long column. He says that those calculations are phony because the calculations coming out of Medicare do not include all manner of administrative costs that are associated with Medicare. That stuff's counted elsewhere, and that's just
exactly
false.
Right.
Is that, Anne-Marie, you think that's right? I want Noam to respond to that because that's that's your best talking point, and a lot of people have already disproven it.
It's false. It's absolutely false.
Let me say two things.
I mean, you've got to let me explain where those numbers
come from. I will in a minute, but first, my friend Noam has to respond.
You can do the numbers a couple different ways, but it's clear that private insurance companies spend a lot of money on marketing costs, and that's just not something that Medicare does. I mean, you could begrudge Medicare that fact. You should say maybe they should be marketing themselves to patients. Maybe they should have to compete in the same way that private insurance companies do. But the fact is they don't spend money on marketing costs. They don't have nearly the same compensation that the top executives at these private insurance companies have to compensate. So right there, you're looking at probably hundreds of billions of dollars in marketing and administrative costs. Let me just make another point, which I think gets to a fallacy that's at the center of this conversation, which is the idea that somehow if the government isn't insuring these people, then society is not, then the economy is not bearing the burden of insurance for people who don't have insurance, which is just crazy. I mean, people who don't have the 50 million people who don't have insurance are showing up in emergency rooms. They're running up enormous healthcare costs. They're developing chronic conditions that are costing you and me and everyone else who has health insurance far more down the road.
I understand, no, there are costs. But is it worth $1.5 trillion or $2 trillion?
Absolutely not.
And Grace Marie, let me ask you this. What's coming down the road from the Democratic Congress and Team Obama? Looks like a massive government-funded agency that is going to be a gatekeeper that will ration services and control prices, which means we are going to incur European-style, Italian-style system. I want you to comment on that.
Absolutely right. Just at the time that European countries, Canada, looking at the United States to figure out how do we build consumerism into our healthcare systems, we're going to turn the other way towards centralization, which does not work, hasn't worked, turns the rest of our healthcare system over to the federal government. Government is not more efficient. There is absolutely no way that it could get to the kind of personalized attention and the personalized medicine that's coming in the 21st century through these top-down bureaucratic rules and regulations, with government mandating what kind of health insurance we have to have, how much we have to pay, how much employers are going to be required to pay, new taxes on individuals, a new government agency that will also impose price controls through the rest of the healthcare system. Where is innovation going to come from when we do that?
Let me just ask you a question, and then you'll get your stick in, I promise. But in the David Leonhardt New York Times Magazine interview last Sunday with President Obama, the President really basically said that we're going to drive, this plan will drive a wedge between patients and doctors, and you're going to set up these federal boards to make decisions known. Now, I think that comes awful close to national health care.
Larry, two things. One, I didn't get that at all from the David Leonhardt interview. I got what Obama was saying was, we want you to be an informed consumer of health care.
We want
you to have all the information available to you about what is an efficient and effective treatment and what is not an efficient and effective treatment. Second thing is,
let him finish, Grace.
I have not seen a plan on the Democratic side that abolishes the private healthcare system. Now, frankly, I'm a single-payer man. I would love it if we went to a single-payer national healthcare system. But the fact of the matter is, that's not happening. Over 60%, 60-65% of people, 60 to 65% of people get their healthcare from large employers. That is going to stay the same way under any Democratic plan on the table.
Do you think that this new public agency, the $1.5 trillion price tag, will not crowd out all the private providers? Do you really believe that? No.
Look, Larry, 60 to 65% of Americans, 60 to 65% of Americans get their health care through large employers. That's going to stay unchanged. So we're talking about the 35% of people who either have no insurance or work in a small employer. Those people are going to have it.
I got to go. I got Ben Bernanke on the other side. I'm sorry. This is a good discussion. It's a good argument. I got to go.